you know that there's things that take longer than the ABCs, and so you're asking for them at the same time. So I asked for finger
At the
stick,
San Francisco
'cause I know it
Veterans
takes some time to
Administration
get that
Hospital,
scanned
Dr.
in.
Gurpreet
You want
Dhaliwal
that
leads his
EKG,
medical
so what a big
students and
logistic
residents
production
on
is to
daily
set it up.
rounds.
And even getting the Ativan, thinking ahead.
Most days are fairly uneventful.
Tap. Tap. Enter.
But today, a 78-year-old man is having a seizure.
Which meds did he
This is a teachable moment for Dr. Dhaliwal's students.
And then can we get a finger stick on him?
It's also a demonstration of the power of mobile technology in the medical field.
I wanted to record his activity because neurology is likely going to come and assess for a seizure. So rather than describe to them what took place, I can just show them a video of what took place, and they'll be able to assess better and treat the patient more appropriately.
Cell phone video isn't the only mobile technology being used at the VA. 15 years ago, the VA began keeping electronic records.
We tried using these computer on wheels for rounding, but it's just hard. As soon as you got to an elevator, it was a showstopper. With this, you don't miss a beat. You keep walking.
The introduction of mobile computing is already changing the way that doctors work, relate to their patients, and teach their medical students. Dr. Dhaliwal's tablet is a PC made by Motion Computing. It's loaded with medical software and references.
All right.
30 at 9:45.
I'm checking all his records.
And it's encrypted wirelessly to the VA's database.
The third one was.
I'm going to check his records at other VA hospitals he's been at.
In seconds, Dr. Dhaliwal has the patient's health history.
2012 CT scan shows that he had basal ganglia infarct, small vessel ischemic changes, no mass.
A new electrocardiogram reading can be compared with records from other VA hospitals.
I'll get the old EKG, 1 second. Getting the EKG is a fairly standard procedure in the room, but one of the biggest parts about interpreting an EKG is finding someone's old one. And that traditionally involved finding their paper chart and hoping you could find the most recent EKG in there, although oftentimes they're floating around in other people's pockets. The second best would be to go outside and find a computer and download his recent EKG, which our computer system can do, but that takes you out of the room for 5 to 10 minutes. Here's his old EKG. What we were able to do was get the piece of paper that was fresh, and it wasn't yet in our records, but we could compare it with all the EKGs we had in the VA system.
The man eventually made a full recovery. The cause of his seizure was never discovered, but Dr. Dhaliwal says that being able to access records on the tablet saves precious time in emergencies and for everyday rounds. For some patients, like Andy Burley, who served as a Navy medical corpsman, seeing and discussing lab results on the doctor's tablet is a welcome addition.
The lab test just came back in today, and they're in better shape than they've ever been before. So
Doctors have everything right there at their disposal. This thing show, like what your past EKGs have all measured up to, so you can see the different diagnoses right there. And so it's a lot easier to make a better diagnosis and treatment.
A floor up at the VA is Dr. Paul Heineken. He also uses computerized records, showing a patient his x-rays to discuss pain treatments.
Your symptoms now only coming this far down your leg.
But he's not convinced that the tablets are a medical practice cure-all.
I think it's a question of maintaining one's ability to relate to patients. If the tablet gets in the way of that, or the computer gets in the way of that, that's a problem. If students, residents think that all information is available on that device, they're missing out what the patient is giving them.
Dr. Dhaliwal agrees that the technology can be disruptive, but he's sticking with his tablet, which he says has become indispensable.
But it wasn't clear cut. Technology has its problems, so it's not to say that they're a panacea, but ultimately the benefits in medicine, which is a complex field that requires a ton of information, a ton of resources, and really a lot of thought, is aided substantially by technology. So I can't imagine how it's not going to be used more and more and more, and how we're going to get better and better and better at it.